Good morning. It is 11 o'clock and welcome to our daily webinar here at the HispanicStar.org, the Hispanic Response and Recovery Action Plan, for us to be able to mobilize and activate our community to be able to help mitigate the incredible impact that COVID-19 has, particularly in our community, in our small businesses, in our entrepreneurs, in our independent workers. We're trying to be informed and also create actions to be able to mitigate the impact today and collectively start thinking about not only the now, but also the near, and look at next, because there will be a next, and the recovery plan is in our hands to start building now. We need to be moving from fear to action and from fact to hope. So it is my absolute honor today to be welcoming one of the pillars of the Hispanic community, one of the first leaders that I met actually when I started getting involved in the Hispanic issues. His name is Dr. Robert Rodriguez, an author, an incredible leader again, an author of a book that I read, Auténtico. Dr. Robert Rodriguez is the president of DRR, advisors, and he's going to be highlighting the key considerations that Latinos ERGs should take to remain relevant during these chaotic times. Because as what we know, most of us, like working in corporate America belong, or the people that you talk to, Dr. Robert Rodriguez, belong to ERGs, which are employee resources groups, or BRGs, business resources groups. And they are consolidated into groups. They belong to large organizations, and they actually get together to inform the company, but also to create community. Dr. Rodriguez, what is the advice? What can Latinos ERGs be doing this time around for themselves and also for the community? Welcome to be with us, Dr. Robert Rodriguez.
Thank you, Claudia, and thank you to all my Hispanic Star community colleagues. I'm excited to spend some time with you this morning. We'll make this short, we'll make this quick, but definitely I plan to share with you some information that not only hope you'll find insightful and useful, but hopefully share with you information that you can apply and leverage right away as you look to elevate the impact and effectiveness of your employee resource groups. I'm speaking with you today from my home in Chicago, so welcome. I know all of you are spread throughout the country. I hope that you and all your families are safe and staying healthy. As I go through this presentation, if you do have a question, feel free to type it in on chat or hang on to it. If we do have any time at the end, we'll ask those, but if not, I'll make sure that the team gets me those questions, and I'll be more than glad to answer those for you. So if we go to the next slide, what I want to do is share with you some of the experiences that I've had with working with these organizations. All these companies listed here are clients of mine, and every single one of them, I've helped them with either their Latino initiative that they have on looking to recruit, retain, develop more Hispanic professionals, or working with their employee resource group. So this is the experience that I want all of you to benefit from, because when you've had the privilege of working with as many companies as I have, it puts you in a very special position, right? It allows me to take a step back and say, hey, what's trending? What's the discourse? What's the narrative happening with these employee resource groups? And this is the experience that I plan to share with all of you today, because having worked with a lot of companies, particularly right now with this COVID-19 pandemic, we're seeing lots of changes, we're seeing lots of action, and that's what I want to share with you today. So this is the experience that you're going to benefit from. So if we go to the next slide, so here right now, the top 4 things that we're seeing with these employee resource groups. Now I'm going to focus specifically on Latino employee resource groups, Hispanic Latino groups, but we're seeing similarities with the other employee resource groups at these companies. That includes the women's ERGs, veterans, disability, Black, African American. They're taking a similar path, but I'm going to focus specifically on the Hispanic Latino employee resource group. So one of the things they're making sure right now is that they are maintaining a sense of community with their membership. In many cases, these Latino ERG members, they work at the same location, same buildings, and they're able to meet in person. Now with this COVID-19 and everyone working from home, they're saying, hey, we want to maintain that sense of community with our membership. So they're doing webinars just like this, video chats, calling in and checking in on each other more informally and formally. So that's one of the things they're really trying to maintain. So that way their members don't feel that they're in this alone, that they've lost contact with their fellow Latino ERG members. So that's definitely one thing we're seeing these Latino ERGs focus on. Secondly, is they're reassessing their programs, their key initiatives to say, hey, we had these activities planned throughout the year. Now with the current environment, is that realistic? Do we want to go ahead with some of these initiatives? Can we move these initiatives virtually? Can we put this off till next year? So it's really kind of taking a step back and reassessing, hey, where are we at? What do we want to focus on? What's a priority? And what do we think is realistic given the current environment? Of course, they're looking at their budgets, right? A lot of these Latino employee resource groups, some of them don't have very much budget at all. So they're looking for ways to, best utilize and allocate those limited funds. Some of them are, applying those funds towards different initiatives, things that are more focused on professional development or community outreach. They're just really looking at their budget allocation and seeing what makes the most sense for them. And then because there aren't as many Latino ERGs happening right now, some of them are taking advantage of this somewhat quiet time from an activity perspective and focusing on their governance to say, hey, now's a good time for us to re-examine our ERG handbook or make sure our bylines are up to date. Do we have the right organization structure? Do we have the right budget request in line? So they're taking this opportunity to really kind of solidify the foundation for their employee resource groups, and that is kind of their ERG governance practices. So these are kind of high level, kind of the four main areas we see these Latino employee resource groups focus on. As we go to the next slide, we'll share with you a little bit more specifically what these groups do. Now, this is what we call the 4C model. It's a model I created about 10 years ago. It's now become almost a standard framework for companies and their employee resource groups. And in general, all the 4C model advocates for is that anything these employee resource groups do can fall under one of four buckets, right? The first bucket is careers, right? Those are any initiatives being led by these Latino employee resource groups that helps members with their careers. So that includes professional development workshops, mentoring initiatives, leadership panels, lunch and learns, external speakers, those things, again, aimed at helping members with their career advancement. The next C is commerce, right? What can we do to help support the business, right? We don't want to be seen as only the food, flag, and fun folks. We need to be a business resource group. So the commerce kind of category looks at those efforts. So can we serve as an internal focus group? Can we help translate, material? Can we help diversify our supplier base? Can we help the company connect with diverse customers? Community is the third C, and that's pretty self-explanatory. That's all your community outreach, connecting with community leaders, being involved in this Hispanic Star program, for example, supporting our nonprofits, volunteerism, benchmarking, those kind of external facing initiatives that a Latino ERG does. And then the fourth C is what we call culture, right? Those are those initiatives by a Latino ERG looking to elevate the cultural competency within their organization. So they want to tell the community more about the Hispanic demographic. They want to raise awareness. This is where a lot of the Hispanic Heritage Month kind of celebrations and events fall into. So this is the 4C model. So again, anything an employee resource group does can fall under one of these four buckets. So under normal times, these are the types of initiatives we see taking place, right? A Latino ERG will try to focus which C do we want to kind of really prioritize, where are the events we want to do. But now because of COVID-19, we are starting to see a bit of a switch, right? That their focus is becoming much more kind of granular, much more laser focused. They're not working on as many things, but they're still leveraging the 4C model. So for example, if we go to the next slide, here's what we're starting to see. These ERGs are focusing now during this COVID-19 pandemic. So if we look at the careers category, for example, they're still doing workshops, but now as we all understand why, they're doing those more web-based. And the focus of those, webinars are becoming a bit, different, right? They're doing sessions on things like mindfulness, virtual work habits. How can we help you work more effectively at home? They're saying, hey, you can still leverage these ERGs as a way to increase your capability, your visibility, even though you're not in the office. And now at most companies, it's the time when they do their annual performance review. So they're helping their members to say, hey, how can you leverage your work, all the great things you've done to support the Latino ERG, and put that on your performance review so you get credit for that when it's time to do your annual appraisal. So those are the types of things we're seeing these Latino ERGs do in the career bucket during this COVID-19 pandemic. Now, when it comes to commerce, a lot of our organizations are being impacted severely because of this tightening due to COVID-19. So many of them, of these Latino ERG leaders, are meeting with their executive sponsors, right? Many employee resource groups are assigned a senior executive to help them strategize, help them make sure that they are, their activities are in line with the company's activities. So they're taking this time to meet with their executive sponsors virtually to say, hey, how can we support the business? I know we're taking a hit on our sales. Is there anything we can do from a Latino ERG perspective to help mitigate that, to help support the business? They're looking to provide input on new marketing initiatives, and they're trying to help their company find new diverse suppliers. With a lot of Latino-owned, Hispanic-owned businesses now hurting, a lot of these Latino ERGs are trying to say, hey, how can I connect this Hispanic business to my company so they can become part of one of our suppliers, hopefully not only support our organization, but support that Hispanic business. So we're seeing a lot of activity there. Other community, they're saying, hey, how can we support our community partners? Is this a time for us to do some benchmarking with other Latino ERGs? And the topics we're seeing are quite interesting. I know, for example, the parents ERG at some companies, they're doing webinars on activities that parents can do with their kids. A lot of us are having to work from home with little ones, so they're doing webinars and sharing resources and ideas on how to keep the kids entertained while they're at home and not at school. And we even had one Latino ERG where their member was a former military vet who used to cut hair in the military. He did a quick little webinar to how to give haircuts at home, particularly for children. And a lot of folks signed up for that. Again, just trying to maintain that sense of community, trying to be a useful resource to their Latino ERG members. And then on the culture side, what these Latino ERGs are doing is they're looking to say, hey, now's a good time maybe for us to do a member survey. As I mentioned earlier, let's fine tune our governance practices. Let's maybe establish new metrics. We've been told we don't have metrics that matter. So let's use this time to identify what those metrics could be. And they're also using this time to try to identify future leaders of their Latino employee resource group, doing some succession planning, if you will. So again, still focused on the 4C model, but much more specific based on the COVID-19 pandemic. So as we move to the next slide, and here, these are just a few examples as we look to kind of wrap this up is, for example, here's one company, they're a client of mine. I helped them put together kind of a cadence, a regular operating kind of schedule, an operating rhythm for their Latino ERG initiative. So, under normal times, this is what their calendar looks like, right? So if you look at this chart, you see the 4 columns, Q1, Q2, third quarter, fourth quarter. Under each column, you see the various months, so January, February, March under Q1, April, May, June for Q2. And then on the left, you see their different activities that they tend to hold. So you can see that they used to do a monthly meeting with their members. That's why there's a dot all across that row. They used to do a meeting with their executive leader once a quarter. They would do a committee lead call, 4 or 5 times a year. Anyhow, what they're doing now is they're taking a look at this calendar and say, hey, I think this is too much. I think this is unrealistic under this COVID-19 situation. So, it's an example of one company taking a look at their existing kind of initiatives and saying, where are we going to pull back? Should we only do a member meeting, every other month now? And how are we going to do that? Can we, pull back on some of these initiatives because we can't get together? So it's an example of how some companies are changing what they're doing based on the current situation. A few more slides and then we'll start to wrap up. The next slide, if you will, what we're doing here, this is an example of one company that has taken this advantage of this downtime to do an assessment. There is, for example, something called the 4C ERG assessment, where ERG members go online, answer these questions, and then the company is able to see how strongly are they doing in the various 4C categories. So this particular company did an assessment back in 2018 where they had 200 or so of their Latino ERG members fill out a survey. And we're not going to take the time to explain the entire circumflex here, but the one on your left is kind of what their results indicated back at 2018. Because things have slowed down now, they recently retook the assessment in the middle of March, and we analyzed the results, and you can see there's some improvement, right? You know, their assessment results on the right are stronger than the assessment scores on the left. Anyhow, it's just another example of, hey, this Latino ERG decided to use this COVID-19 situation to assess their employee resource group. And now they have some actual data. They can make data-driven decisions on where to focus on moving forward, because they took the time to assess, and at least on the one on the right, over 500 of their Latino ERG members took the survey in that example. So if we go to the last slide, one of the last two slides left, here's another example. This particular company, you know, their Latino ERG said, hey, we need to develop a much more richer scorecard of how, you know, we're tracking the impact and relevance of what we're doing. So this particular company put together this chart. I helped them kind of design this to say, okay, you know, what are we doing in the areas of talent acquisition? What's our membership look like? You know, what's our field engagement? What's the profile of our membership? How many professional development workshops are we holding? What's our business impact? And what's our community outreach? So in this one slide, they're able to share this with their top executives to say, hey, we're still relevant. We are still active. We're still making an impact, not only on our membership, but on our organization. Even though things maybe have slowed down because of COVID-19, we still matter, right? And we're moving forward. So this is one example. You know, the last slide here that I'll share with you, if we go to the next one, I think it's just another example, right? Similar type of thing. This particular company, they put together this dashboard that says, hey, what are the things that we're working on, right? You know, how many chapters, recruiting, community events, general feedback. Again, you can read this on your own, but it just shows that they have a holistic value proposition, that they are helping their membership, they're helping our Latino community, they're helping the business, and they're helping the organization through their activity. So, yeah, as we go to the final slide, that's just kind of my contact information. I know I went through a lot of information. I went through it quite quickly, but if you want a copy of this deck, I'd be more than glad to send it to you. There's my email address, there's my cell phone. You know, you can text me, there's my social media handles. You know, I'm committed to helping our Hispanic Start community. I want to be a resource, so don't hesitate to call, you know, leverage me in any way. I'd be more than glad to serve the sounding board.
And Dr. Rodriguez, this is fantastic. I think that I would like two things. The first one is to say, you have an incredible network of ERGs. I think of you as the ERG, you know, like every time I think, how do I reach out ERGs or BRGs, is through you. I would think that there is a lot of value in sharing best practices and sharing lessons learned. Maybe you can hold a weekly webinar, not at 11 o'clock, maybe just like a Dr. Rodriguez ERG webinar, and showcase in weekly basis or whatever it is, in frequent basis, one ERG that is willing to share their practices and how they are coping and what are the lessons they would like to do. But the number two is, Dr. Rodriguez, we keep on hearing this word that these are unprecedented times. But they are unprecedented times. None of us have ever lived through anything like this. I myself specialized on global mobilization, having done crisis, specialized on war. I've never seen anything like that, because the world has not seen anything like that in decades and centuries. What we have is we have absolutely to understand that our community is one of the most affected communities by COVID-19, because the industries where we are the places where we work. And we're exposed not only because we have lost our income, we have lost our jobs and our salaries, but we're exposed because we keep on working. We keep on actually farming. We keep on actually delivering the food. We keep on working on delivering everything that we have. So we live in multi-generational homes. We're exposed ourselves. We have lost the income. If there was a time for ERGs to do one thing together, this is a time. Absolutely. And I ask you to consider doing something together so that we can integrate a program where all ERGs, all ERGs in this network, everyone that is here in this webinar is willing to understand that we have a problem that we can solve, that this is a problem affecting all of us at the personal level, health level, but we haven't started thinking about the economic impact that this pandemic has in our community. And so I would say there are three things based on what you said in your presentation about reassessing key initiatives and programs. Please reassess thinking community as one of the 4 C's that you have that will help in the other 3 C's. We have launched the Hispanic Star Hubs all across, like America. So if you are an ERG in different parts of the country, the solutions are local. The people that need a job are local. The people that might need a hand from the ERGs are local. So we would love to make sure, Dr. Rodriguez, that we create a partnership in which we elevate the ERGs to have one project together, which is get out of this COVID-19, mitigate the impact today, and get stronger than we came into, so that we can really consolidate that Hispanic community. So act local. Number 2 is activate corporations. Like all of us, the 75 Hispanic organizations behind the Hispanic Star, we're putting together the 10 asks for corporate America. ERGs have an incredible channel to make sure that, corporates hear it, that we can say, this is a time in which we need corporate America to step up, and here are the 10 things that you can do to help Hispanics, because we need to know this is not only a charity, this is the smart thing to do. Demand will come back, and we don't have the supply there. We're going to have an economic crisis, and you know that. And the last thing is to make sure that we think of recovery. I mean, we're thinking of the now and the near, but there will be a next. And we have to together start looking at how does recovery look like, and how can we incentivize that. Maybe, Dr. Rodriguez, we can have, like you mentioned, Hispanic Heritage Month. It's been our joint dream to do something substantive.
Yes.
Forget about food, like food flag and color, whatever you call it. But we can do something where all of us, all ERGs together, kick off Hispanic Heritage Month, September 15th, to say something. And we do something and we connect, so that we can help those that have been suffered the most in this. So,
Absolutely.
Dr. Rodriguez.
Yes, you can count on me. More than glad to help. I love those ideas. I'll work with you and the team to mobilize that, make it happen, so that way we're not just talking about it, acting upon it. And yeah, we're the community to do this. We are very collectivist in nature, right? We have a strong sense of family. Let's leverage that strength, that source of strength, that asset that we have in our community, to help mobilize and help our fellow Latino brothers and sisters. So yes, you can count on me. Glad to help.
And Dr. Rodriguez, we have a number of people that have expressed interest in having your presentation. I also would like to ask every one of you that are in the webinar, that if you would like to be part of this, everything that we've been talking about, how to activate ERGs into a collective plan, just say it. I'm on board. I'm in. Count me in, so that we can actually go back to you and count you as part of what we need to do. This is the time for Hispanics and ERGs to, to do the best for yourself and to do the best for all of us. This is the time for Hispanics that need to be united. Dr. Rodriguez, any final words?
Well, I'm excited. It keeps bleeping on me, all these folks. I'm in. So I love it. Thank you very much. No, appreciate being part of this initiative in general. Honored to call you a friend and all your colleagues there. We are all human. Thank you for this opportunity. You can count on me to help move this initiative forward. Please stay safe, stay healthy, and don't hesitate to reach out if I can be of any help. And yeah, absolutely, more than glad to share the presentation with anyone who wants it.
And Dr. Rodriguez, just to keep a final, yes, we count on you. Would you think it is a good idea to host a webinar with different ERGs showcasing your network, just your clients, and having, like in weekly or bi-weekly, whatever you want, frequency, to have ERGs that want to showcase what they're doing, so that we can all learn and share best practices and lessons learned?
Yeah, absolutely. I've already been doing that in person with my Clio group, but this is a great way to mobilize and move that online, which makes it easier to do more frequently. Yeah, so I'll connect with you offline. Let's make that start to happen. Let's create that benchmarking. We'd be glad to help.
Thank you so much. We promised 20 minutes of a webinar. We're 24 minutes, so we have to close it here. I know that some of you have sent questions. We will make sure that we direct them to Dr. Robert Rodriguez for his response. I want to thank you again, Dr. Robert Rodriguez, the president of DRR Advisors, for being with us today, and very much looking forward to count on all of you that have been today here, so that we can activate all our ERGs, and together we can get out of this one, mitigating the impact today and looking at being stronger in our feet back tomorrow very soon. Thank you so much.
Take care.
Thank you. Bye.
Ciao.